Hey there, friends. Welcome to episode 369 of Better Than Before Breast Cancer. I am your host, Laura Lummer, and this is our Tuesday Terrain Talk, where we talk about all kinds of great stuff, small steps, little things you can do to support the optimal functioning of your amazing body. Of every little cell in it, just support it as much as you can. And today is no different. We're going to talk about something really important. And this actually takes me back to in the early 2000s. I graduated from California College of Ayurveda in 2006. And what we're going to talk about is supplements because I get asked all the time about supplements. Now, to be clear, as a certified terrain advocate, even with my degree in health coaching and certifications in health coaching and all that, recommending supplements, telling someone to take it and giving them a dosage is outside the scope of my practice. It's not something that I do. But what I do is educate people on what supplements can do and why someone might want to take a supplement so that you can take this information and discuss it with your doctor or with your naturopath. So it takes me back to 2006 when I graduated from California College of Ayurveda, because as a part of that process of studying Ayurveda and graduating from that school, I hired my own clinical Ayurveda specialist because I wanted to have that patient experience, or the client, I should say client experience. They're not licensed medical people, the client experience. And I was super excited to get my herbal recommendations, right? And part of that training was creating herbal concoctions for people. And so I think that that's kind of regulated from state to state. But it was interesting because I really wanted herbs, right? When I went to have my intake and I filled out all this paperwork and I was so excited to go there and get my plan and to get the herbal recommendations. And she didn't give me any. She told me to go home and practice mindful eating, I was let down at the time until I figured out how difficult mindful eating actually is. But then I started my practice and I started developing lifestyle programs for people based on these Ayurvedic techniques and theories and practices. And everybody wanted herbs, right? Everybody was like, what herbs? What herbs can I take? What herbs are you going to make for me? And back then I did make them specialized for each client. So it's so interesting. I think we just have like this romance with them. I think we think maybe because, since Western medicine, since we all grew up with Western medicine, you get a pill, it makes you feel better. So there's just this kind of a romance we have with the idea of supplements, and that if something isn't working, we take a supplement and that's going to fix it. And, supplements are powerful. They can have a big impact on our body, but they can also have not the kind of impact that we want. We really have to understand why you would take a supplement or why your body has a deficiency to begin with, if it indeed has a deficiency. So, a lot of times I hear people ask me about different supplements, and I ask them, I don't know. What do your labs tell you? What are your levels of that in your blood? And they don't know. Why will we go take a supplement if we don't even know what our blood levels are now? That could be a really big mistake. So, in this show today, I want to talk to you about two supplements that people ask me about all the time: iron and calcium. I want to talk to you about why we want to think about those with a little bit of a different mindset than just the general population who has never received a cancer diagnosis. And then also why you think you might need it. And I'll give you some reasons that I hear from people commonly, and what else you might want to look at first before you turn to a supplement. And then hopefully by the end of the show, you will also have some great questions if either one of these supplements is something you want to take. So you'll have some good questions to go and talk with your doctor about. Or if you're already taking them, you'll have some good questions to think about or to ask your practitioner about to make sure that it's working for you and you're doing it safely, right? All right, so let's talk about why would I even say that we think about supplements differently if we have had a diagnosis of cancer versus if we hadn't. Isn't it still a human body? It absolutely is. But since we have had cancer and since we know that the body makes malignant cells, and we don't know why exactly cancer decided to grow in us, right? We want to make sure we're doing everything we can to support the healthiest function of our body and not fuel cancer. Okay. We want to be tissue focused, body focused, and we want to make sure that our body isn't providing a lovely breeding ground for cancer. So, cancer patients are often discouraged from taking iron supplements because there is a relationship between iron and cancer cell growth, as well as the fact that overindulging in iron supplements can also have negative effects on the body. So, let's talk about each of these. Cancer cells have a high demand for iron, and it's necessary for their proliferation, for them to grow, and for their metabolism. So think about our body. We have a metabolism, but each one of these trillions of our cells, they have a metabolism. They're taking nutrients in, they're putting waste out, they're doing all kinds of work inside that cell. And excessive iron can promote tumor growth and metastasis because it can provide resources, fuel for cancer cells to thrive. Also, if we have too much iron in our body, then it can contribute to the formation of free radicals. And that increases oxidative stress. Oxidative stress puts us at risk for cellular damage, including DNA damage, which contributes or can contribute to cancer progression. Oxidative stress, in the simplest form, I actually think I gave this a similar analogy a couple weeks ago. I did a show on detoxification and talked about how we could think of our body like a city and garbage trucks needing to come in and take trash out. Well, think about if the garbage man is on strike, as has definitely happened here in California before, things build up and get stinky real quick. So think of oxidative stress as if the garbage people are on strike and the trash is not getting picked up and it's building up and building up. And now it's starting to cause problems, right? So oxidative stress is when we have too many of these free radicals, too many toxins, they're overloading the cell and the cell cannot function optimally, right? So another risk, there's a couple more risks. These are like pretty extreme. One is hemochromatosis. That's going to be a genetic problem as well, a polymorphism. It's something in our genes that could drive your body's ability to use iron effectively and so that it builds up in your body. That's actually something that is tested for in the 3x4 genetics report. And then there's another condition called hemosiderosis. And that, again, is going to be kind of an extreme. That's not like everybody gets this, right? And that's just where iron overload leads to a different condition because the iron accumulates too much in organs and tissues and can cause damage to specific tissues. So when we have iron overload, too much iron, it can lead to serious conditions. It can cause damage to the heart, to the liver, and it can even be a complication in diabetes. So it can really complicate just the overall health management of someone who has had a cancer diagnosis, of a cancer patient. So then we take iron and we think we're doing ourselves a favor, but it can actually affect our immune function. And we want the optimal function in our immune system as possible, right? So even though iron is really important for cell function, too much iron can create a problem for immune cells. It can reduce their ability to fight infections and cancer cells. Iron overload can increase inflammation in the body, which is already a concern for cancer patients because of disease treatments like chemotherapy, radiation, and just the root cause of disease, which is too much inflammation, right? So, why do people then take iron? If all of these are potential risks, why would we take it? Well, a lot of times nutrition is a problem and we're undernourished, but we don't know if we need iron unless, again, we're looking in our blood. But people start to feel tired and we relate very easily this I'm fatigued to I'm probably anemic. So there's an interesting thing called anemia of chronic disease. And cancer patients can experience that. And it means where iron gets sequestered into white blood cells and liver cells, making it unavailable for red blood cells, which is the red blood cells are a big transport for iron and oxygen. This protective mechanism kicks in where our body kind of sequesters it, holds it back. So even though we might see normal or high iron stores in the body, it's not available for the body to use. So for that reason, iron supplementation should be really thoughtfully discussed with your doctor. It should be considered on an individual basis. And it's definitely not something that you want to be supplementing if you don't even know the status of the iron already in your body. All right. We don't want to be randomly diagnosing ourselves and taking supplements and potentially increasing our risk of promoting cancer growth, increasing oxidative stress, increasing inflammation, iron overload. So, before we even think about supplements, again, do we look at food? And I know a lot of medical practitioners, medical professionals are going to want to look at food first. Are you getting enough iron through the food that you eat? Are you nourishing your body properly? Are you eliminating processed foods and chemicals that don't need to be in your body that might be decreasing your body's ability to function properly? And are you getting enough whole foods, dark green leafy vegetables, good, healthy, grass fed, grass finished animal proteins? So, the best approach to iron supplementation is talk to your doctor about it first. Don't just think that because you're tired, you should be taking iron or that you might be anemic. And in fact, when people come to me and they say, I'm tired all the time, iron is the last thing that I think about. The very first thing that I think about is hydration. Are you hydrated? Are you drinking half your body weight in ounces of water every single day? Are you using electrolytes? Do you put a little bit of good Himalayan or Celtic salt in that water? Are you getting good rest? Are you getting good sleep? If you're not getting good sleep, then we have a whole list of things we can go through to say, how do we improve sleep? But I would go through all of that first before I would ever even attempt to say to somebody, oh, go take an iron pill, right? There's so many other ways we can go about this, especially if fatigue is what you think you're addressing. Because when someone is anemic, they have more than just fatigue. And so it's really important to talk to a doctor about that. Stay safe, right? So let's talk about calcium. Now, I have a lot of clients who are concerned with calcium because they're concerned about their bone density. And we meaning people who have had a breast cancer diagnosis as part of treatment, often are given drugs that can impact the health of our bones. But when we turn to things like supplements, I think we have a false sense of security when it comes to supplements. We have a false sense of security in that we think herbs and vitamins are going to be safe and they're always okay to take because we think of them as natural. And that is absolutely not true. So even something that sounds as benign and harmless, right, as calcium, there are risks involved with that. So some cancer type, particularly those that metastasize to the bone, like breast, lung, and multiple myeloma, can cause elevated blood calcium levels, hypercalcemia. And then if you're taking additional calcium through supplements, that can make this condition worse. And it can lead to a lot of complications, including anything from kidney stones to neurological symptoms and even heart issues. So symptoms of hypercalcemia include nausea, vomiting, abdominal pain, fatigue, muscle weakness, confusion. And here we go with the fatigue again. So we just talked about that element with iron. What if you're experiencing fatigue? You've not tested or been monitoring your blood, and you think you're anemic. So you start taking iron when the problem is calcium, right? And you're not even addressing the problem now. And then people take, and I hear this often too, they take iron, they say, well, I should take more, or it's not working. I'm still tired. So we got to look at the data first, the facts first, and understand what's happening in your blood and talk to a doctor about it before you take a supplement. Whether your doctor is a standard of care doctor, an oncologist, a naturopath, but someone who understands it. So another reason why is that calcium supplements can interfere with the absorption and the effectiveness of some cancer medications because calcium can bind to some drugs in your gut, and then it reduces your ability to absorb them or use them efficiently. So it's really important that even if your doctor did say, hey, I want you to take a calcium supplement, that you talk to them about the timing of that. Should you take your calcium at the same time you take your medication? Because certain breast cancer medications are particularly oral chemotherapy agents. That's something I take. And oral hormone therapies are another one. So tamoxifen, Xeloda, letrozole, anastrozole, those are a few of the drugs that can bind with calcium in your gut. So you want to make sure that you're avoiding potential interactions here by consulting with a healthcare provider who knows what they're talking about when it comes to supplements and medications, so that you get the optimal effectiveness from your medication and you get the optimal effectiveness from your supplement if they're telling you to take one. And I'm going to refer back to the same advice that I talked about with iron. If And I know osteopenia and osteoporosis are big concerns for a lot of my clients, and for good reason, right? We're aging, typically, people are over 50, but even if you're younger and you've been put into chemically induced menopause, bone health is an issue, is something we want to focus on. Then we take things like aromatase inhibitors and SERMs like tamoxifen, and those impact our bone health directly. So it's a valid concern to be thinking about the health of our bones and to be thinking about how we keep our body healthy enough so that it doesn't move into stages of osteopenia and osteoporosis. But before I would say, think about a supplement, I would ask, what does your diet look like? Do you have a healthy, well balanced diet? Or are you eating all the dark green leafy vegetables? Are you getting, it's like Popeye, are you getting that spinach in, right? Are we getting calcium? If you do eat dairy, are you using clean, grass fed, pasture raised dairy products, maybe other products that are fortified with calcium? So, have you got your food dialed in? And if you've got your food dialed in and you're working with a doctor and your calcium levels are still not sufficient, then for sure, I'm sure you guys will talk about some kind of calcium supplementation or maybe something else that's available to you. So, getting your regular blood work is really important. Like, blood tells so much. It's such an important story. And you can monitor your calcium levels in blood. So, if you look, or this is, part of this whole way of educating you on what to think about in terms of your body and in terms of food and supplements, is if you're looking at your blood work and it says that you have sufficient levels of calcium and you're being told to take a calcium supplement, I would ask why. Why do we want to do that if it's looking like I already have an optimum level of calcium in my blood? What's happening there? Right. And if that's because, well, your body's not using it effectively, this is something to dig into with your doctor and understand the benefits and the effectiveness of taking anything other than food, right? That's why we've got doctors. They're experts on this stuff. So when I talk about having your team together, know what your team player's expertise is and use that, right? So I get a lot of clients that are super frustrated because their doctor doesn't tell them the right things to eat. But their doctors aren't nutrition experts, right? So, but their doctors are medicine experts and they understand interactions. And if they don't understand the interaction, if they're like, I don't know, and that might be dangerous, more often than not, they'll tell you don't take that because we don't know the interaction, right? And you could look further. You could look for a naturopath who maybe is more up to date on herbs and vitamins and minerals and nutrition supplementation. There are definitely specialists out there. So, just first educate yourself. Know what's actually happening in your body, know what's happening in your blood, and don't just assume because you're experiencing a kind of what you would call a symptom, like fatigue, for instance, that taking a supplement is going to fix that. You've got to have the data first so you stay safe. I remember when I first started studying at the Metabolic Terrain Institute of Health with Dr. Nasha Winters, hearing all of this about iron and calcium. I didn't know. Nobody had ever told me this. I didn't read about this. And so I went and I looked at the supplements I was taking, and I had to get some of those out of my routine and find a doctor who knew how to work with these supplements before I went back to that supplement plan or before I even started a brand new supplement plan. So I really and truly believe that's very important. And even though I know that calcium and iron are two big names and big players when it comes to women's health and to just overall health, super important that we don't underestimate the power of these minerals, right? The power of any kind of supplementation, because your safety is always the most important thing. And again, we're not cancer experts. So, how would you know that something like calcium or iron could fuel cancer growth? And when you hear that, I don't want you to get scared and go run in the other direction and think, oh, don't take anything or don't eat anything that has calcium or iron in it. No, we need these things to function and function optimally. But we just need to understand what we're doing before we start putting more of it into us. All right. I hope that helps. Hope that makes sense. I hope that helps you learn a little bit more about supporting your amazing body. And if you want to work with me and dig deeper into the metabolic approach to health, you can come and find me at thebreastcancerrecoverycoach.com. I work with people one-on-one, and I have, of course, my amazing group membership, which is the Better Than Before Breast Cancer Life Coaching membership. And then I also do metabolic health coaching. You can check that all out at my website, and I'll talk to you again soon. Take care.